My name is Amy Paller. I'm the chair of the Department of Dermatology at Northwestern University Feinberg School of Medicine. I'm the corresponding author on an article recently published at the British Journal of Dermatology entitled Efficacy and Safety of Ixekizumab in a Phase 3 randomized double-blind placebo-controlled study in pediatric patients with moderate to severe plaque psoriasis. The study is also known as IXORA PEDS. Plaque psoriasis is a common and burdensome skin disease with an early age of onset. It affects approximately 1% of children and adolescents. Early recognition and treatment of pediatric psoriasis is important for overall health and quality of life. While multiple treatments are available for adults with plaque psoriasis, there is a limited number of well-studied and approved treatment options for pediatric psoriasis. Ixekizumab is a high-affinity monoclonal antibody that selectively targets interleukin-17A. IXORA PEDS was conducted to evaluate the efficacy and safety of ixekizumab for moderate to severe plaque psoriasis in pediatric patients. Eligible patients were 6 to less than 18 years old and had moderate to severe plaque psoriasis. During a 12-week double-blind treatment period, patients were randomized 2-to-1 to either ixekizumab or to placebo. Treatments were administered according to baseline weight every 4 weeks. After week 12, all patients received open-label ixekizumab. The co-primary endpoints of IXORA PEDS were the percentage of patients at week 12 who achieved at least 75% improvement in the Psoriasis Area and Severity Index, or PASI 75, and a static Physician's Global Assessment, or SPGA score, of 0 or 1. Both co-primary endpoints were achieved at week 12. 89% of patients achieved PASI 75 with ixekizumab, significantly more than the 25% of patients with placebo. Similarly, 81% of patients achieved an SPGA score of 0 or 1 with ixekizumab, again, significantly more than the 11% of patients receiving placebo. Ixekizumab also resulted in significantly greater responses than placebo for other outcomes that measured complete skin clearance, improvement in itch and quality of life, as well as clearance of scalp and genital psoriasis. Responses were rapid, with significant improvements observed as early as week 1. In addition, responses at week 12 were either maintained or further improved through week 48. There were no new safety signals identified in the study, and the safety profile of ixekizumab was generally consistent with that seen in adults. Crohn's disease was reported in 4 patients, or 2%, including 1 patient during the double-blind treatment period and 3 during the maintenance period. Each of these were adjudicated as probable Crohn's disease. When this study was initiated, etanercept and ustekinumab biologics were approved by the FDA and EMA for pediatric psoriasis. The EMA had also approved adalimumab for pediatric psoriasis. Recently, ixekizumab was approved by the U.S. Food and Drug Administration for moderate to severe psoriasis in patients 6 years and older. Ixekizumab is the first biologic targeting interleukin-17A that is approved for pediatric psoriasis, and thus becomes an important additional treatment option.